ignore or we downplay our own health issues. So how do we convince men to take their health seriously? Let's bring in Drew Klein. He's president of FocusWave Clinic, Inc. here in Ottawa. It's the men's health clinic. Good morning. Thanks for your time.
Good morning. Thanks, Leslie.
Are we as men? I mean, I get this. I mean, I remember my mom used to say, go to the doctor, get your health. I'm like, no, I'm fine. And I saw that with my father. Are we getting any better as we learn more as men that we need to take care of ourselves, our own health too?
Well, men are a procrastinating bunch. And, at FocusWave Clinic, we speak about this from positions of deep personal experience. So, we are dallying creatures when it comes to matters of our health. We die earlier than women. We work longer hours. We commit suicide at higher rates. We suffer from, alcoholism, drug abuse at elevated levels when compared to our female counterparts. And yet, there's an old adage that women get sicker and men die quicker. It's called the gender health paradox. And I think one of the major reasons for this is that women tend to act on their illnesses much quicker than men. And, we avoid going to the doctor and we avoid seeking out medical care. So, since we deal with a lot of men here at FocusWave Clinic, we hear lots of reasons why they should not do the treatments, specifically for treating sexual health conditions that we treat here. But there's really only one reason why men do it. They stop making excuses. They try to get their lives back, so we try to help and push men to go forward and improve their lives.
It seems like we wait till the symptoms as opposed to thinking about preventative. You talked about sexual dysfunction, specifically erectile dysfunction, I guess, is your specialty there.
Yeah, so at Ottawa's FocusWave Clinic, we're the city's newest medical clinic, and we're Ottawa's, Shockwave Therapy experts. We're using this amazing young medical modality called focused Shockwave Therapy to treat sexual health conditions and chronic pains. And so they're treating, we're treating erectile dysfunction, Peyronie's disease, and chronic pelvic pain, both in men and women.
How much of our male population suffers from erectile dysfunction? Do we have a number?
So the numbers are pretty clear. About 50% of men over the age of 50 suffer from some form of ED. And as you get older, it gets, 60% of men over the age of 60, 70% of men over the age of 70. It's very prevalent. It's a vascular issue. It's a blood flow issue, and it can be treated and in some cases reversed. Peyronie's disease is a different condition that also can cause erectile dysfunction, but Peyronie's disease affects about 10% of men. And chronic pelvic pain syndrome in men is about 2 to 6% of the population, but in women it's much higher. Endometriosis is a very common pelvic pain condition that affects women, and something like 70% of all chronic pelvic pain in women is due to endometriosis. Well,
we hear about it with women much more than men. I didn't realize pelvic pain was an issue for men.
It's usually something called non-bacterial prostatitis, and it's there's really no etiology for it. They don't know why it happens. Just men who are dealing with chronic pelvic pain, and it can be treated using focused shockwave therapy like we do here at FocusWave, and the results are truly amazing.
How does shockwave therapy work exactly? I mean, I have a picture, but explain it to me.
It sounds a lot scarier than it is, but most important is that it's a non-invasive, drug-free, and more importantly, painless and side effect-free treatment for all of these conditions. And so we use a national regulator-approved device for treating these conditions. Basically, it's like a wand, an electromagnetic shockwave therapy wand that sends electromagnetic shockwaves to the penis and crura and to other parts of the pelvis. And what it does is it does a couple of different things. The main feature of it is that it produces neovascularization, which is new blood vessel formation from the existing vasculature. And also it can clear blocked blood vessels using shock waves. And it can also reduce pain, as we see in a number of our chronic pain patients.
A lot of men are shy to talk about it. That's why we wanted to express it here. It's FocusWave Clinic. The president is Drew Klein. Thank you. Appreciate your time, Drew.
Thanks for having me.
Cheers. 11 o'clock, News Talk 580, CFRA.